Hi, everyone, and welcome to this episode of Good Morning Sunshine. I'm one of your co-hosts, Brandon Lee, alongside my good friend and colleague, Carrie Pena. We've got a great guest on with us today talking about fully integrative healthcare here in Arizona. Susan Levy with Native Health is here with us today. Good morning.
Good morning. Thank you.
Yeah, it's so great to have you here. And what I really love about the space that Native Health is in right now is that it's fully integrative. And like what I like to say is really providing a one-stop shop for so many families, especially in our underserved communities. Why do you think it's so important to be able to provide a one-stop shop, especially when we're providing those services for underserved communities?
So that everybody can do everything in one stop. So as you mentioned, the medical, the dental, the behavioral health, WIC and wellness programs. We've got a food program, so we've got food pantries, we have clothing closets, we have Department of Economic Security, community legal services, we have everything in one stop. So if they're having a hard time getting there, they're taking the train or the bus or walking or driving, they can do everything in one stop.
And this is a key focus of Molina Healthcare that I know has been a huge supporter and partner to you guys. How important has Molina Healthcare been for you in your mission?
They have done so much for us. So this past weekend, they funded a bike rodeo where we were able to get a couple hundred kids Razor scooters and helmets and some safety. And so for parents that were struggling to get those kids bikes or Razors and helmets, they were able to get that. They just funded our open house health fair, as well as 200 car seats. So we were able to put those parents at ease and make sure that their kids were properly fitted into appropriate car seats and then installed in vehicles. So,
you know, you've worked at the company for 18 years, you said?
Almost 18 years,
So talk to me, when some folks listen and they think, okay, so healthcare and then you're giving away car seats, and we're talking about whole person care here, right?
Right.
That's really where this has gone. Talk about the significance and what you've seen, the trajectory of that over the last 18 years that you've been involved in the organization.
Well, it's definitely changed. Social determinants of health has really come into play, obviously, in the last few years. One-stop shops, like you mentioned, so working with like Department of Economic Security, housing, food, whatever people might need. And so it's really looking at the whole person and what they need and the family needs and making it easily accessible. So I think that's changed a lot.
It's a big deal.
Yeah.
Right? Isn't it such an exciting time for you, having worked in this for so long?
Yeah. A lot of partners, and partnerships are key. And nobody can do it all. So you need partners to help you kind of move the needle and make the change to the community.
Have you seen a difference in the people you guys are serving, either healthier families, from parent to child, being able to offer all of these services in one place?
I think so, and they seek us out. And they want to come, and then they participate in a lot of programs and classes and opportunities. And that's when partnerships come in, and that is so key. Because, we don't have the money to do all these things, to buy Razor scooters, to buy car seats,
right?
Urban senior food boxes that we have. And Molina pays for that, and that's a really important service for our elders that don't have the money or need supplemental food or items.
And when it comes to insurance, right? Because I think a lot of people are like, oh gosh, got to go to the doctor. Well, maybe I don't have insurance, or maybe I'm on access, and I think, bringing health equity is a huge personal mission of mine. And that just because you're on access, you should still be given the opportunity to go to a really nice clinic and receive really good care. And it shouldn't determine if you've got private insurance versus Medicaid or Medicare.
Or uninsured.
Or uninsured.
Right.
So what's your message to those people who sit there and go, gosh, I don't even have access?
We serve anybody and everybody walking through the doors. So being a federally qualified health center, we serve everybody.
How do people find out more information? And if they're in Arizona, and how can they get involved?
nativehealthphoenix.org is the website.
So what I'm hearing from you, just as we close things out, is there is a lot of hope in the healthcare space, and a lot of that is attributed to the partnerships that are taking place. You're identifying the need in your particular community, and then you're partnering with an organization, in this case, Molina Healthcare, and saying, this is what we need. We need backpacks, or we need this kind of outreach. You're saying, let's meet people where they are.
Yep. And they do a tremendous job being responsive to the community and really coming up with innovative ideas and ways to support the work that we do.
If you would like to see something even added, what we're not doing today, that you see a need within the community, is there anything that you just kind of sit there in your mind and be like, God, I really wish we could also do something like this and kind of manifest how we can deliver even better care? Or are we doing a good enough job in where we're at right now?
I think we do a pretty good job, but you can always do more, right?
Right.
More and better. Housing is super important, but I know that's a citywide and statewide issue. Transportation's always an issue. And I think food insecurity, so always adding more food programs for families that are struggling.
Yeah, because I mean, the last time when I was still on the news and we were doing events, we used to always say, 1 in 4 children in the state of Arizona go to bed hungry every single night. And kind of how do we solve that crisis?
That's a tough one.
Yeah.
People do struggle, and they are struggling now. And I would say the food that we get every week, we run through, we don't even make it a week with our deliveries.
Which even shows you that there's even such a need. And when we talk about even just our overall health, that if we don't have a house, if we're housing insecure, that plays such a role in our overall health, right? And it's, job security, are you home insecure, are you food insecure? All of that actually plays a role in our overall physical health.
Right, it's like Maslow's hierarchy of needs, right? So how can you worry about your health if you don't have a place to sleep or you don't have anything to eat?
Susan, thank you so much for the work that you continue to do. 18 years, and you're still excited about the future of this work, so appreciate you. Thank you so much for being here.
Thank you.
And thank you for watching this episode of Good Morning Sunshine. If you want to learn more about Native Health, the website again?
NativeHealthPhoenix.org.
NativeHealthPhoenix.org. I love it. And since you're already here, go ahead, hit that like and subscribe to our channel, that little alarm notification bell. You'll be notified every time if you subscribe when we upload a new episode. Thanks for joining us. We'll see you back here for the next episode of Good Morning Sunshine.
Take care, everyone.